Hi, good afternoon. My name is Namrata Garbuzapun. My student ID is 220355307. I'm one of the students from Master in Nursing Practice, third year. Today, I'm going to give a presentation on medical emergency call. So let me share my screen first. Let's talk about first talk about what is medical emergency call, med call, which is very important in hospital or in any other healthcare setting. So it is a situation where an immediate medical attention is required due to a person's serious health condition, injury, and illness. Today in our presentation, we are going to talk about Mrs. Mans. She's a 75 years old lady. She was presented to ED at 9 o'clock in the morning from home due to decrease in GCS and breathlessness. As also, she had a fever for 3 days and felt drowsy for a couple of days. And also, she had an intermittent cough, but she was unsure about what is the cause of the cough because she is a regular smoker and she has a cough. And then the medical was activated by the team at 10:30. Now I'm going to talk about all the clinical manifestation that she has. The reason why the team called the med. So the clinical manifestation to activate med call are these all. So increase in respiratory rate, low SpO2, hypotension, increase in heart rate, low decrease in GCS, and high fever. So let me talk about all the clinical manifestation to activate med call in clear. So let's talk about airway. Her airway is clear and patent, and there is no any obstruction, sign of obstruction, which is a good sign, and there is no any immediate intervention required for her airway. But there is a risk of airway obstruction in the future because she is a little bit drowsiness, and then her GCS score is 13 at the moment. Talk about breathing. One of the clinical manifestation to activate med call is her high respiratory rate. Her breathing rate is 28. And also, she has low oxygen saturation. She's saturating at 75% on the Houston map. So, but she is improving her oxygen saturation to 95% with BiPAP initial setting FiO2 50%. Sorry, 50%. It is also noted that there is a decreased airflow or reduced air sounds at the basis of both lungs. And also her ABG result shows that she has respiratory acidosis and hypoxemia, which indicates that she has a respiratory failure. Let's talk about clinical circulation, which is one of the clinical manifestation to activate a med call. She has a low blood pressure, which is 90 over 50, and then also one of the clinical manifestation is high heart rate, which is 118. So it's her high rate, heart rate 118 and low blood pressure 90 over 50 shows that she has severe sepsis and possible circulatory shock. Due to this reason, the medical was activated. And her heart rate was 118 because her heart needs to compensate to low blood pressure. Moving to next slide, let's talk about the disability. Her GCS score is 13, which is one of the clinical manifestation to activate med call, obviously. And we says that her mental status is altered, and because she is a little bit drowsiness. It shows that she is confused and disoriented. It is due to systemic inflammation in her brain, and also hypoxemia and hypercapnia, and can also affect the brain function and GCS score. According to her laboratory findings, she is hypercapnia and hypoxemia, which is the one of the reason she is her GCS is 13. And her temperature is very high. Talking about her temperature, 39.8, which shows that she has a sepsis. And also she was complaining of right upper quadrant abdominal tenderness, which indicate that she might have infection or inflammation in her liver or gallbladder. Talking about fluid, she's not tolerating any oral fluids. That's the reason she's nil by mouth at the moment. And she is passing urine only 50 ml per hour, which shows that she is dehydrated. And also glucose level, her glucose level is 9.8 mmol per liter, which is slightly high. And moving to the next slide, let's talk about pathophysiological link to clinical manifestations and underlying disease. Mrs. Mann has a history of emphysema. She has a history of hypertension, ischemic heart disease, and smoking history for long years. Let's talk about emphysema. So emphysema is a chronic lung condition where the walls of the alveoli break down and leads to tiny air sacs in the lungs, and this decreases the surface for area for gas exchange. Due to the lower alveoli, her oxygen saturation is low, and then carbon dioxide is high in her blood. That's why her oxygen saturation might be decreased due to emphysema. She's saturating 8 to 95% with BiPAP support, which indicates that she has severe exacerbation of chronic respiratory condition. Let's talk about background history hypertension. Hypertension means high blood pressure, which means that the hypertension can damage the blood vessels, and also it can damage the organs such as heart, kidneys, and brain if it goes for a long time. So in her case, she has a indication of sepsis. So her body's immune system responds to an infection with inflammation, and at this point, her body releases various chemicals like cytokines and nitrite oxide to fight with the infection. So this chemical can cause increased blood flow and widen blood vessels and allow the immune cells to reach the infection site, which leads to the blood pressure low. Let's talk about ischemic heart disease. She has a history of ischemic heart disease, which means that narrow of coronary arteries. That reduces the blood flow to the heart muscle. So in her case, she has 80% RCA stenosis and previously unsuccessful PCI. Which means that she has significant heart disease. Due to her background history of ischemic heart disease, her heart is already compromised, and also she has a low blood pressure that leads her heart to pump more, and her heart rate was increased when the medical was activated. Talking about her smoking history for a long time, she has a history of smoking for a long time, which helps to damage her lungs and cardiovascular system. She already weakened her lungs by smoking for long years, and when our lungs is already weak, there is a high possibility to get infections quickly, like pneumonia. And the X-ray report clearly shows that she has potentially left lower pneumonia. This is the reason why she is feeling difficulty to breathing, and then she has a respiratory rate high. Let's talk about sepsis and multi-organ failure. Sepsis is a life-threatening condition, which is triggered by abnormal immune response to infection, which leads to extensive inflammation, tissue damage, and organ failure. According to a primary survey and other laboratory findings, it is indicated that she has severe sepsis and multi-organ failure. The X-ray shows that she has a potential left lobar pneumonia, and the sign and symptoms she was showing indicate that she has severe inflammatory response. When there is an infection, the inflammatory mediators cause vasodilation, which leads to hypotension and tachycardia at the same time, and ultimately lead to compromised perfusion to vital organs, and it leads to more multi-organ failure. So hypotension decreases the blood flow to the kidneys, also decreases the kidneys' ability to move waste and toxins, and also decreases their ability to balance electrolytes and fluids. C is urinating low. It increases and then C has a high creatinine level and then decreases EGFR. It indicates that C is likely to have a acute kidney injury. And this is the sepsis pathway. To clear more information on sepsis, how she got sepsis. Let's move to another slide. Pathophysiological link between underlying disease conditions and the clinical manifestation. Now let's talk about emphysema and smoking history. She has a history of emphysema and have been smoking for long years. It shows that she already compromised her lungs for over years. And due to emphysema, it reduces air entry in lungs and increasing respiratory rate. And also ischemic heart disease. She has a history of IST, and then she has a blockage in her right coronary artery stenosis with reduced blood flow to the heart and leading to heart disease. Underlying heart disease, this heart disease put extra pressure on heart, therefore it lead to low blood pressure and high rate of in her case. So she has also unsuccessful result of history of percutaneous coronary intervention, which shows that she has a severe cardiovascular disease, which contributes her to show signs and symptoms of respiratory distress and decrease in consciousness. Let's talk about sepsis and multi-organ failure. It is obviously it is a life-threatening organ dysfunction caused by infection. So she has a high fever 39.8, which indicates that she has a severe infection, and also which lead to high white cell count. And to fight with the infection, high lactate level reduces supply of oxygen and supply of blood. She feels drowsiness, and also her GCS was decreased due to poor perfusion in her brain, due to hypoxemia and blood pressure. Let's move to the another slide. We're going to talk about the management plan for all the high priority clinical manifestation. So nurses need to first need to make a plan. So first one is respiratory support. So talk about respiratory support. Her respiratory rate is high and she is saturating in low. So it is important to continue her in BiPAP machine with FiO2 to 50% to maintain her oxygen at 95%. And also we need to check her oxygen level to ensure that she is not saturating more than 95% to make sure she is safe. And also it is important to check her respiratory rate and lung sounds regularly to see any improvement in her breathing. And also it is important to monitor ABG result closely to manage her respiratory distress. And also bronchodilators such as short-acting agonists need to be administered to relieve bronchospasm and improve her airway patency. And also nurses need to monitor any sign of respiratory failure and prepare for any potential intubation if necessary. The second one is fluid resuscitation and vasopressor therapy. This is one of the many important management plans because she is nailed by mouth. So it is important to administer IV fluid immediately to improve her blood pressure. And then if hypotension remains same after administering IV fluids, administer a vasopressor to increase our blood pressure. So it is important to monitor her blood pressure and heart rate regularly, and also need to monitor her urine output to look for any sign and symptoms of fluid overload. And also another one is supportive care. So supportive care is one of the most important management plan, because her GCS score is 13 and she is drowsiness, so there is a possibility of airway obstruction in the future. So it is important to put her bed in low position and use the side rails if necessary, so to prevent falls and injury. Also, performing frequent GCS score is important to monitor any changes in her responsiveness and consciousness. So it is also essential to correct hyperglycemia immediately to prevent any further deterioration. So another one is antibiotic therapy for pneumonia and sepsis. High temperature and is the indication of infection. Therefore, to control the infection and to support organ function, it is important to start broad spectrum antibiotic immediately as per hospital sepsis protocol. So also it is important to take blood culture before administering any antibiotic to see to identify the source of infection. And also nurses need to monitor white cell count, CRP, creatine, and liver enzyme, and also lactate level to assess any response to treatment of the infection. Lastly, we have a management plan, effective communication and coordination with the healthcare team, which is very important. Nurses would have clear communication with the healthcare team about Mrs. Mann's treatment plan and her condition to ensure her safety. Which is very important. So in conclusion, managing her high priority clinical manifestation shows that she receives prompt and timely care to improve her condition and prevent further deterioration. I have included all the reference list here, as you can see. Thank you. This is the end of the presentation.